The governor of Enugu State, Peter Mbah, has reaffirmed his administration's bold commitment to strengthening grassroots healthcare delivery with the successful upgrade of a Type 2 primary health center in Awgu, Awgu local government area. The modern facility situated in Awgu community was developed under the Enugu State Primary Health Care Development Agency in collaboration with the Enugu State Ministry of Health, forming part of a strategic statewide initiative aimed at providing accessible, affordable and quality healthcare services across all 260 electoral wards in Enugu State. During an inspection visit, Governor Mbah, represented by senior officials including Ifeyinwa Ani Osheku and the Commissioner for Health, Professor Obi Emmanuel Ikechukwu, conducted a comprehensive assessment of the facility's operational capacity. The visit also attracted key political stakeholders including the APC State Chairman, Martin Chukwuwike, and the Chairman of Awgu Local Government Area, Uchenna Joseph Okolo.
So we have two NYSC couples, they're both pharmacists. Yeah. And they've been with us for quite a while and they've been very good here.
Designed to deliver around-the-clock healthcare services, the solar-powered facility boasts an impressive array of modern infrastructures, building a functional laboratory, labor and delivery suites, consulting rooms, accident and emergency units, pharmacy, medical record department, male and female wards, nurses station, staff quarters, and a full-equipped medical store. The integration of clean running waters and sustainable energy underscores the administration's commitment to resilient healthcare system. In a moment that captured the human face of governance, Governor Mbah encountered an indigent patient receiving free medical care alongside her child. In a compassionate response, he approved a 2 million business support grant for the woman, while also announcing additional incentive aimed at boosting the morale and productivity of healthcare workers across the state. Commending the management team led by Ani Osheku, the governor expressed satisfaction with the facility's standard in infrastructure, staffing and service delivery. He emphasized that the upgraded center is part of a broader rollout of Type 2 primary health centers supported by the recruitment of over 2,250 healthcare personnel to ensure optimal service delivery statewide.
I am truly delighted to be here today. And for me, this is not just a perfunctory. This is a serious business. It's not just coming to fill the register. It is for me an opportunity to have first-hand feedback, undiluted feedback, because we're here to essentially ensure that the projects we're doing across our states, across the 260 electoral wards we have in the state, they are for us not just about earning public acclaim or earning bragging rights. It is about the people. These projects are meant and designed to serve our people. So it is incumbent on us to ensure that the money we have invested here, the structure we have put here, the facilities we have put here, and the equipment, that they are serving the people. And when we come for visits like this, the idea is to get a feedback from the community stakeholders, the Igwes, our women wing, our politicians, our youth, to ensure that this facility that we have put here is serving them, and that we also have the human resources that will provide those services. I want to thank the heads of the Primary Healthcare Development Agency, the Executive Secretary and her team, for the quality of service I witnessed here today. For me, it's quite optimal. It's optimal. There's always room for improvement. Yes, thank you. What I've witnessed here, first is a constructive engagement with members of staff, those that are working at the different wards, at the lab, also met with some of the consultants, engaged with the traditional rulers and our women organization, and we're able to get firsthand what this facility is doing. This facility is equipped with solar, so there is 24/7 power here. There is also water. I turned on the tap myself, made sure the tap is running, went to the various facilities to ensure that, thank you, to ensure that these facilities are working. I also looked at the building to also ensure that the building is of the standard that we have paid the contractor to do. And I can tell you that we're proud that everything seems to have ticked all the boxes. So we commend you highly.
Describing primary health care as a foundation of an effective health system, Mbah highlighted the critical importance of preventive care, immunization and maternity health services. He further noted that the state's expanding health coverage framework is already improving affordability and access, while significantly reducing mortality rates.
What you have seen here today is typical. It's not just an isolated project. It is typical because you have this type 2 primary health care center across our 260 electoral wards. And it's not just building, we have also equipped them. And of course, this equipping, as we talk, is ongoing. But in addition to the equipment and the building, we've also gone ahead to recruit workers. We approved the recruitment of 2,250 healthcare personnel last year. And thank you. That figure was not just plucked from the blue. It was as a result of gap analysis that was carried out, and we found out that we needed that number to ensure all our facilities, all our primary healthcare facilities are fully staffed. As the commissioner said, this is our first line of defense, and in fact even our first line of attack. We just don't want to even be defending. We talk about preventive medicine. preventive practices, because you know that prevention is better than cure. So which is why our primary healthcare facilities are critical, because they provide that first line attack. We ensure that we provide our children with all the vaccinations they need to prevent them from being exposed to all the diseases that you have children exposed to when they are growing up, when their immune system is not well developed. So that is why you have centers like this for parents, for children to come in here and get those vaccinations. It's also very accessible and affordable. Somebody mentioned the Basic Health Development Fund. We're going to make here also a center for the Basic Health Development Fund. So what that means is that we're going to enroll a lot of our people in this community into our universal healthcare coverage, so that whether you have money or not, you can come here and access free healthcare because you're covered. You have the healthcare coverage.
Looking ahead, the governor announced plans to commence ward-by-ward project tour across the state beginning April 1st, 2026, with Anewi as the starting point. He also pledged additional support for the Awgu facility, including the provision of a child incubator and an ambulance, urging residents to safeguard the center as a collective community asset.
So much. And in terms of even elevating the quality of service, so we go for the pago maka, we can improve the quality of service. Here they can incubator. So I'm more what I need a incubator. We should be able to have one here. So we're going to bring an incubator here. We also have a lot of technology in Kaketa. Email to machine maybe before. So we're going to deploy technology. No one came for hand in use, but we've also agreed to bring some ECG. So we can do all those things here for the hearts, so that, and we've also agreed that now we an ambulance aggregation center. So anyway, a serious case that this hospital cannot handle, we ambulance that will at least service a number of wards. But those things will do. And maybe do my ward tour next month. 1st of April, and all of them can area what the first wards maybe go down. So all the wards, and the whole idea of that ward tour will come with a first-hand feedback of because at the end of the day, all Madi are human beings, are people. That's the only reason I run a government house. And if we're in government house and they way part of us, no matter the location, now they are comfortable, they have access to basic amenities. Our job is not done. Because we're only as good as that our weakest link. So the image of us is reflected by the lifestyle of those people. So we must make sure we provide the basic amenities. And what's that basic amenity? Roads. It's not asking for too much. Water. It's sad that name will, but we are intervening in 127 communities as I talk. So I would make sure now with the end Ruasa to go to Oduma, Echi. Let them go to Oduma. Because in Kemiri, we have to do something about that immediately. So let's intervene, Kemiri.
In his remark, the Awgu Council Chairman, Honorable Uchenna Joseph Okolo, warmly received the governor and lauded his administration's developmental strides across the council area. He highlighted key projects such as smart schools, upgraded health centers, the revitalization of NYC infrastructures, the Game Village project, and an ongoing 55-kilometer road network.
Thank His Excellency Dr. Peter Ndubisi Mbah for citing this quality of Type 2 health center, not only in Awgu, not only in all the wards in our local government, but in all the wards, 260 wards of Enugu State. The health center cited here is not just a building, it's a world-class center that will be delivering world-class primary health care delivery. If you enter inside, you will agree with me that it is equipped to the teeth with the latest state-of-the-art medical equipment to ensure that we have medical service to all nook and crannies of Enugu State. This is taking healthcare delivery to people's doorsteps. This particular health center is serving Awgu ward. An Awgu ward is one town ward. So, notwithstanding that the equipment are state of the art, His Excellency has graciously also given the approval to even improve on what is here in terms of getting an incubator for anytime there's need for that, and also centralizing an ambulance system, an ambulance service system that will be serving a few wards of cluster. So we cannot say help but thank His Excellency for prioritizing healthcare delivery in Enugu State, because they say health is wealth. And also, we don't have any other option than to keep supporting him, praying for him for good health, long life, and prosperity. We are also extremely ready, vehemently ready to ensure that he continues this good work in Enugu State beyond 2027 and up until 2031, as we are going to vote him 100% in the coming general election.
Okolo also commended the inclusion of Awgu in the proposed transport hub initiative, describing it as a catalyst of economical growth. He stressed that the Awgu Health Center served a wide population and has been significantly enhanced to meet community needs, particularly with the planned addition of critical medical equipment. Reiterating that health is wealth, the chairman expressed gratitude to the governor for prioritizing citizens' well-being and assured sustained grassroots support for his administration. He further disclosed that security has been reinforced across health facilities with a structured 4-man security framework, while staffing gaps have been addressed through large-scale recruitment efforts.
As His Excellency has declared here that they have, from the state level, they have closed the gap of lack of workers by employing up to 2,250 medical health workers in the tune of doctors and nurses. On our own part, we will continue strict errand supervision, across all our health centers to ensure that the health workers are always here to do what they are called for. As you know, we have 2-bedroom staff quarters behind this facility so that we can have all-round service, because a pregnant woman might want to put to bed, even in the midnight. So we don't have to, have lack of workers here. So from the local government level, we'll keep a very strong supervision to ensure that the workers are there, and they are there on time, and they are there permanent to ensure that they do what they are called for.
In an interview, the traditional ruler of Awgu, Igwe Maurice Ebu Ezeakowan, expressed profound appreciation to the governor for the project, describing it as a commendable and impactful development for the community. He prayed for more grace upon the governor to accomplish his greater project and assured that security around the facilities will be strengthened through the support of the Neighborhood Watch, who will ensure that the health center is properly protected and maintained.
I'm thanking the governor for Enugu State for what he have done to Awgu. I'm ready for him to continue to do this. I'm thanking him and reminding him to send us doctors and the nurses that will attend our people who is sick. So I'm promising that our back is very, very happy. They will do all they can to make sure that the municipalities will be guided. We have neighborhood, we have counters, so they will guide it very well.
Goodwill messages were delivered by key stakeholders including Annie Usheku, the World Health Organization Zonal Coordinator, Iboku Chimwanya, and Professor Ikechukwu, all of whom commended the administration's transformative impact on the health sector.
Your Excellency, as you can see, the people are truly excited because we know that once you touch their health, indeed, you have touched their hearts. And that's because we also recognize that health is the pathway to economic development. And this is one thing that your administration is very particular about. We say thank you so much because everywhere we look at, your footprints are everywhere. We want to especially acknowledge your support, especially in the Primary Healthcare Development Agency. Aside the 260 primary healthcare facilities that have been constructed, which host a flagship of all of the basic amenities. We want to thank you for the healthcare workers that you recently approved. That is truly a defining moment in healthcare. Already, Your Excellency, we are recording in thousands the number of babies that have been born. We have indeed lost count. And these are babies that perhaps would not have been able to have the opportunity to see the tomorrow that we speak about. We also would like to acknowledge Your Excellency for the massive support in the Child Nutrition Fund. As you rightfully stated, Nigeria is besotted with a lot of stunting and wasting issues from malnutrition. But Your Excellency, you provided a nutritional support fund of 160 million contributing to what UNICEF has to offer. And these commodities will be handed over in the coming days to ensure that our children have the right start in life. In addition, Your Excellency, for the Basic Healthcare Provision Fund, you have graciously approved 139 million to complement the efforts of the federal government. You didn't stop at that, Your Excellency. You have also, in addition, approved another sum of 50 million naira to complement the provision of essential medicines in our primary health care center. That is indeed monumental, and we say thank you very much. For the community members, would like to say that let us own it, let us protect it, and let us utilize it. Sometimes we have cases of vaccine hesitancy. It is our own. Remember that this is a legacy that we're providing for our children. So it is one for all and all for one.
I want to congratulate His Excellency for the giant strides you are making in healthcare service delivery in Enugu State. It only shows that you understand the role of PHC in development, because the PHC, primary healthcare, is the foundation of health development. And the PHC, the type 2 PHCs have become the gold standard for PHC development. I think other states will have Enugu State to emulate on what it means to truly prioritize healthcare service delivery. So it is really something to be commended. And I've also listened to the response you've given to the stakeholders. And it's also a testament that you are in touch. In fact, some of the medical terms you use in describing the situation really underscores that you have a deep understanding of how the health system works. And I really want to commend you for that. And the only thing I will say that WHO has been an eternal partner of Enugu State. We have supported the state and will continue to support the state In 2025 alone, WHO spent close to 2 billion in support of your government. And one of those support was when we supported the health training institutions in Enugu State, of which Your Excellency received our WHO country rep. And those equipments are already being put to use in the 2 schools of nursing of Enugu State. And we'll continue to do more.
Your Excellency, I know it is only something that you are so passionate about, like the health of Enugu, that will drag you out this evening, a Sunday evening. Many people didn't even know that you are back from Abuja. Very hectic 1 or 2 weeks, but still, because of the health of our people, you are here this evening to give a detailed supportive supervision to one of the type 2 primary healthcare centers that you have spotted, one in each ward of Enugu State. Your Excellency, we cannot but tell you that we are proud of the work you are doing in the healthcare sector. Your Excellency, recall that this is the same local government where we have upgraded a small school where they are training you to a college of nursing sciences stated in the Awgu General Hospital. Your Excellency, this is that local government where WHO and you have worked to expand that school and make it accredited. Your Excellency, this is still the same local government where we have cited one of the 2 special oxygen plants that we have in Enugu State. It is in the Awgu local government, the Awgu General Hospital, that we have a plant that manufactures medical oxygen that can go around this whole locality. Your Excellency, the work you are doing is proactive. You are not waiting for problem to come in health sector before you solve it. This is the first time you have ordered us in the Ministry of Health to activate the public health emergency room before the outbreak of any disease. Because Lassa fever spread to more than 20 states and you ordered us to get going. Your Excellency, I'm happy to inform you that we are still on alert and Enugu is still safe. Malaria is being tested and treated free of charge from the Enugu. We cannot mention all of it. There is no time. Your Excellency. Today, I decided to talk about the work you are doing from primary to quaternary, but I just talked about the healthcare services. I want to tell you, Your Excellency, that the healthcare workers in Enugu State are pleased with what you are doing. We are now receiving requests for people are migrating from even federal hospitals to our teaching hospital.
In a show of appreciation, the people of Awgu ward, led by former Awgu chairman Stanley Okeke, alongside community leaders including Kenechukwu Okolo and traditional ruler Igwe Morris Ebo Ezeakunwan, presented gifts to the governor. The community pledged continued support and massive mobilization ahead of the 2027 general elections.
His Excellency the Governor, we, the people of Awgu, we're so happy to hear me. When no same way na-ekweghị nkwa ihe anyị mere na vote anyị tụrụ anyị ji etinye gị na seat anyị nọ to be the leader of Enugu State na come 2027 na anyị ga-emekwa the same thing. On that same note, our Igwe ekwugo okwu ebe nni anyị wetụkwa ka ahụkwara opportunity ahụ wee gwakwa gị na same ụzọ akata Igwe kwuru o jere Amịrị jee n'ome the same ụzọ agba kakwa straight to ebe a na-alụ smart school and imeli anyị nwapụ ndị Awgu anyị ga-adị very happy. And we are also here with the President General by wee sị na ụdị efi anyị ji bụ ihe anyị ga-eji anyị ji wee sị gị thank you to our place.
The event drew a distinguished gathering of political leaders and stakeholders, including the member representing Awgu South in the Enugu State House of Assembly, Anthony Chukwudiwankwo, Commissioner for Human Development and Poverty Eradication, Professor Benedict Ekutosi Okoli, Deputy Chairman of Awgu Local Government Stanley Ezediuto, and other notable figures. The ceremony was further enlivened by the vibrant cultural display from the Awgu dance group, reflecting the community's rich heritage and collective pride. Residents who spoke during the visit describing the upgraded facility as a transformative milestone, noting that it will erase pressure on secondary and tertiary hospitals while significantly improving access to essential healthcare services. With the latest intervention, the Mbah administration continues to translate policy into tangible impact, delivering not just infrastructures, but renewed hope and healthier futures for communities across Enugu State.
When you think of online TV and radio, broadcasting, media consultancy, event coverage, event management and planning, there's no better name than Ogama TV. But that's not all. We're also into photo studio and coverage, equipment rental, news blogging, fashion and pageantry. We are at number 5/21 Chime Avenue, beside Open Sheraton Restaurant, New Haven, Enugu. Follow us on our social media handles: Facebook at Ogama TV, Instagram at Ogama TV1, Twitter at Ogama TV, website www.ogamatv.com. You can also send us email at ogamatv@gmail.com. Ogama TV, your one-stop media solution.